Hello friends, today we discuss some important question regarding nursing officer exam. Question 1. Which of the following developmental stage corresponds to infancy? Trust versus mistrust, autonomy versus shame, initiate versus guilt, industry versus inferiority. Let us see answer of this question. The correct answer is option A, trust versus mistrust. The developmental stage that corresponds to infancy is trust versus mistrust. The stage is a part of Erickson's psychological theory of development. Infancy generally refers to the first year of child's life during which they are highly dependent on their caregivers for their needs and overall well-being. Next, question number 2. Which of the following is a first-line drug of choice for pain management? Acetaminophen, clonidine, morphine, ketamine. So the correct answer is of this question is acetaminophen is a first line drug used for pain management. Acetaminophen is considered as a first line drug for pain management. It is commonly used over the counter medication for mild to moderate pain relief and fever reduction. Next, which of the following is the organism that causes peptic ulcer disease? Staphylococcus, Corynebacterium, Helicobacter pylori, Streptococcus. The correct answer is option C. Helicobacter pylori is the organism that causes peptic ulcer disease. The organism that causes peptic ulcer disease is Helicobacter pylori. Helicobacter pylori is a bacterium that infects the stomach lining and is a major contributor to the development of peptic ulcer. Next question. Which of the following is an important nursing intervention for a patient with Cushing syndrome? Left middle cerebral artery, observe for hypotension, protect from infection, restrict carbohydrate intake. The correct answer is option C, protect from infection. An important nursing intervention for a patient with Cushing syndrome is to protect them from infection. Cushing syndrome is a condition characterized by excessive production of cortisol or the prolonged use of corticosteroid medications. This can weaken the immune system and make individuals more susceptible to infections. Next question. An involvement of which of the following structures will lead to right-sided hemiplegia and aphasia? Left middle cerebral artery, vertebral artery, brain stem, right middle cerebral artery. The correct answer is option D, right middle cerebral artery. The involvement of the left middle cerebral artery would lead to right-sided hemiplegia and aphasia. The middle cerebral arteries of the major blood vessels responsible for supplying oxygenated blood to the lateral aspects of the brain, including the cerebral hemispheres. Right-sided hemiplegia refers to weakness or paralysis on the right side of the body. This occurs because the motor signals from the left hemispheres of the brain, which controls the right side of the body, cannot be transmitted properly due to the damage of the LMCA. Next question. For the PDF of this practice, join our paid Telegram channel. Next question. Which of the following nutrients helps for tissue repair? Vitamin A, fat, carbohydrate, protein. The correct answer is option D, protein. Among the options you provided, protein is the nutrient that primarily aids in tissue repair. Next question. Which of the following is an isotonic solution? Ringer's lactate, half normal saline, 1/3 normal saline, mannitol. The correct answer is option A, Ringer's lactate is isotonic solution. Among the options you provided, Ringer's lactate is the isotonic solution. Next question. For doing nasotracheal suctioning, During which of the following patient activities the catheter should be inserted? Swallowing, inhaling, exhaling, retching. The correct answer is option C, exhaling. During nasotracheal suctioning, the catheter should be inserted when the patient is exhaling. Next question, question number 9. Which of a patient who is receiving intravenous fluid develop tenderness, warmth, arrhythmia and pain at the infusion site? Which of the following condition you will suspect? Sepsis, infiltration, fluid overload, phlebitis. The correct answer is option D, phlebitis. Based on the symptoms described, the condition that you would suspect in this case is phlebitis. Phlebitis refers to the inflammation of a vein, typically as a result of mechanical irritation or a chemical irritation from an IV infusion. The symptoms of phlebitis often include tenderness, warmth, arrhythmias, redness, and pain at the site of infusion. Next question. Which of one of the following is a common response expected in a patient with stroke to the change in the body image? Denial, disassociation, delusion, depression. The correct answer is option D, depression. A common response expected in a patient with a stroke to a change in body image is depression. Stroke can often result in a physical impairments such as paralysis or changes in mobility, speech difficulties, or changes in facial expression. These physical changes can significantly impact a person's body image, which refers to how one perceives and feel about their own body. Thanks.